Hello, everyone. It's my great pleasure to be here and talk about our work on measuring the personal information disclosure in online health communities. I'm Minjun from University of Virginia, and this is joint work with Faisal Hossein Shizen from University of Virginia, David Hassani from the same school, Professor Gang Wang from UIUC, and my advisor, Professor Yuan Tian from UCLA. During the recent pandemic, people have limited their outdoor activities, including visit to healthcare facilities. So online health communities have seen a significant surge in popularity among both patients and healthcare professionals. These sites connect patients with caregivers, physicians, clinicians, nurses, and even other individuals like non-healthcare workers to share their medical problems. To describe their symptoms, people often share information about their family history, medical history, and images of relevant testing results on these websites, and they seek suggestions from experts or others facing the same problem. In this way, they get benefit from online health communities. The benefits of online health communities are not only limited to patients. Healthcare professionals also use online health communities to get suggestions from other experts regarding their patients' cases. We find three types of user interaction. First, anyone can post their queries where healthcare professionals provide suggestions. Second, healthcare professionals seek suggestions to other healthcare professionals for their patients. Finally, individual tends to answer questions which they often find similar to their previous symptoms or diseases. In online health communities, users post questions seeking suggestions about medical diagnoses and treatments, which often requires sharing medical information. It includes multimodal data containing description, images of medical documents, X-ray, and face images. The discussion contains two types of data, text description and images. From our investigation, we find three types of image data in these websites. The first one is image of medical documents, the second one is X-ray images, and the third one is face images. In this work, we consider the threat model focusing on re-identification attacks of linking a user's medical condition to their real-world identity using those publicly available data in online health communities. If those medical conditions are leaked, it may lead to personal attacks such as blackmail, discrimination such as during job search, harassment, or bullying. Under this threat model, we focus on two types of leakages, identifier and quasi-identifier. Identifier leakage itself can reveal individuals' real identity, whereas quasi-identifier leakage may not always pose serious privacy violation. However, if quasi-identifier are leaked and combined with other information, they can reveal individuals' identity as well. With those in place, we have two major contributions in this work. First, we developed SenRev, a tool to identify sensitive data leakage in online health communities, both in image and text. Second, we apply our tool to investigate the risky surface of 4 online health communities to explore the sensitive data flow pattern and the leakage caused by different user interactions. Later, we discuss several countermeasures based on this. That being said, you might be wondering why existing works cannot identify such leakage or detect such privacy violation in these websites. First, the heterogeneity of health-related data makes it difficult to accurately identify different sensitive information fields. Information extraction techniques in text differs from that of images. Moreover, there are a variety of images shared on online health communities, such as photocopies of medical documents, X-ray, and even images of faces. These images are of different sizes and resolutions. Finally, the communication language varies across different platforms. As a result, we need to analyze multi-language text, both structured and unstructured, from those medical images and text description. To that end, we start collecting data for our analysis from 12 popular medical websites. Through a multi-step filtering process, we select 4 important websites for our study, which are publicly available and contain multi-language contents. This is the complete statistics of how our dataset looks like. It has multi-language as well as multi-type of user interactions. In total, we collect around 1.9 million data for our study. As previously mentioned, we have a multi-modality of data containing medical images and text description. For the image data, we observed that the privacy leakage is different based on the types of images. As a result, we designed medical document detector, X-ray detector, and face detector to detect the 3 types of medical images, and then extract the text from these images using our optical character recognition component. For text, we built a sensitive text detector to identify sensitive medical information. And finally, we integrate privacy leakage detection from both text and image to report the overall data leakage. Now, I will describe one of the key modules of our tool, which is how we have built our sensitive information detector. And this contains face detector and sensitive text detector. For the details about the other components, please read our paper. For sensitive text detector, since medical records and documents are highly structured, we can directly search for the desired data fields and map out their values. Once we locate the desired data field, we consider the next extracted text as the corresponding value of that field. For example, to identify name information, we first look at the name field in the extracted text, then mark the next extracted text as the value of the name. In contrast, X-ray images and post description usually contain unstructured text. We use our role-based approach to detect sensitive information in those contents. We build our own heuristics to capture those leakages in unstructured text. Here I have shown the table for identifying each of those sensitive information in English websites. For example, to detect English names, we build our own name dataset by combining 1,000 most popular first names and 1,000 most popular last names, and consider all of their combinations. Then we investigate the presence of those names in the unstructured text. For detecting Chinese text, the heuristics will be different from this, and we have included a detailed process for identifying them in the paper. Next, another key component of sensitive information detector module is face detector. In our work, we define face images as sensitive if it reveals individual's face image. Note that if an image has obfuscation or if it only shows partial face, we don't classify that as sensitive face images. For building this, we leverage the notion of transfer learning to detect sensitive face images. But we are not able to achieve a good performance due to a very small amount of face data in our dataset. We experience this imbalanced data issue due to the nature of those websites. We perform data augmentation by randomly rotating each of the face image and then use active learning to train the model with augmented data. In the end, we are able to differentiate face images with the other images in our dataset. That's how we have designed and built our tool systematically. Next, I will show the evaluation of sensitive information detector. We built our baseline using hard cascade and dual shot face detector. They don't perform well and have a high false positive rate. This is because they classify partial face image as a face image during training, and this contradicts our definition of sensitive face image. Therefore, we use transfer learning and find that VGG model outperforms other models. So we select this for building our face image detector. Then we evaluate the performance of our sensitive text detector component. And we found that our sensitive text detector performs well in identifying both structured and unstructured texts. It achieves on an average of 97.9% F1 score for identifying identifier leakage and 96.8% F1 score for identifying quasi-identifier leakage in those websites. Here I have illustrated the end-to-end performance of our tool. Overall, we find that SenRev achieves around 93.72% true positive rate and have a very low false negative rate, around 2.55%. After that, we leverage our tool to perform a measurement analysis on those websites. We find an alarming identifier leakage across all of the websites. It's also the same for the quasi-identifiers. So we dive deeper in those leakages to investigate the pattern, reasons, and necessity of those sharing of the sensitive information. We calculate the average number of data leakages by healthcare professionals and non-healthcare professionals. It turns out identifier leakage rate is higher in healthcare professional community, whereas it is low in non-healthcare professional community. There are a couple of reasons behind this. Healthcare professionals, as the domain experts, request more sensitive information for the diagnosis purpose, and they keep asking follow-up questions which reveal even more sensitive information than the original post. Next, we listed the top 5 combined leakage from healthcare professionals from both Chinese and English websites. We conclude that Chinese medical professionals seem to leak lots of combined sensitive information, specifically quasi-identifier in their posts. Such leakage are very harmful, as attacker will be able to link those information to reveal their real identities. Here we have listed both the identifier and quasi-identifier leakage through text and image. We find that information leaked through descriptive text is more sensitive than that of medical images. We have also discussed other findings and insights. Due to the time limit, we cannot go over those at this time, so you can read our paper for more details. At the end, we propose several countermeasures to prevent such leakages in online health communities, starting from deploying automatic detection tool to identify sensitive information leakage, redact sensitive information, and introduce user access model. Thank you for attending my talk. We have open sourced our tool. Feel free to scan the QR code or visit the website. Now I can take questions.
Okay, thank you, Minjun. There's a question in the chat that I'll read out from Thorsten. The question is, it looks as though you are analyzing actual medical data of individuals who are not aware of that and who have no means to consent to your processing. This medical data would be considered special category or sensitive data in most jurisdictions, and processing would usually not be legal for just security research purposes. Could you comment on the legal ramifications of your study and the ethical implications?
Right, we have a whole discussion section in our paper dedicating to the ethical problems of our study, and we do have the approval from the IRB. Our argument is that because those are all publicly available data, so I guess it doesn't really have that much of ethical problems. But yeah, you can read the last section of our paper. We have a long discussion on this topic.
Okay, we still have a couple more minutes for questions. While I scan the Zulip, maybe we can take questions from the audience. Yeah.
In your previous slide, I think you mentioned that you filtered down the healthcare websites based on the fact that some of them did not have any leakage. How did you determine that some websites did not have leakage, and couldn't that be implied in posts based on, let's say, the sex, which is a quasi-identifier? Couldn't that be implied in someone posting in the anyone-to-anyone connections?
Sorry, I have a hard time hearing the questions.
So when you mentioned previously that you guys narrowed down the list of websites in order to analyze, some of them were automatically cut off.
I think there's sounds in front of the microphone, so maybe we can discuss it in the 2 week after the presentation.
Well, I can. So Minjun, you can hear me okay, right?
Yeah.
Okay, I'm near the Zoom microphone, so maybe maybe I can repeat your question if you can make it short. I'll repeat it after you say it again. If we can try that.
When you narrowed down the number of websites to analyze, some of them were cut out because you all determined there was no leakage of information. However, some quasi-identifiers could be implied within posts. So how did you determine that there was no leakage?
Okay, I'm going to try to repeat this question. So the question was, when you narrowed down the websites, you removed some because they didn't have sensitive information. but some of the posts may have quasi-identifiers that might indicate something such as gender or something like that. So how did you justify removing some of those sites?
I think for some of those sites, they have first on some of the websites, they have restrictions to, so they're not all publicly available data. You need to have a healthcare professional license to see the post. And that's why we eliminate some of the websites. And for others, we randomly sample 100 of the posts and read through them and to see if there are any quasi-identifier or identifier in them. And then we chose the most popular 4 websites among of them. Does that answer the question?
Okay, so sounds like maybe yes. So, all right, well, let's thank the speaker again.